Now the Q&A session is open, and you are allowed to roast our presenters with any kind of questions you came up during their presentations. If you need some more time to reflect on what they said, I can maybe go ahead. And I wanted to ask you, Kelly, thank you very much for showing how to assemble such a sophisticated nanosystem, actually. And I was actually puzzled by their applications. I don't know what's the best way to use this sort of particle-in-particle nanosystem. Do you want to use them diagnostically, therapeutically, or, yeah, please, maybe could you elucidate a little more?
This one? It's working. Oh my gosh, okay, sorry. Diagnostically, you can also, I believe you can use them therapeutically as well. They, I think, yeah, this is good. You should be able to, I'll double check with my colleagues just to, afterwards, just to make sure. But you will be able to target certain organs and just to have it be able to be ingested easier as well. And it's less invasive than with the needle from an injectable.
Okay,
yeah,
thank you very much. Okay. Because I strongly believe in nature being a good source for inspiration. And I've never seen nature building these sort of particles, but maybe we just haven't been looking correctly. So where did the idea actually come from to do this?
I don't know. Sorry. Yeah, to say simply, I don't have the answer to that right now.
No worries. Sometimes we have to try without knowing, and knowing later maybe.
Yeah.
It's also a good idea. Thank you. So next I wanted to shift to Hans. Apparently you've been laying a lot of emphasis about the precision or not being accurate enough in measuring particles. And maybe you could explain us a little further why you lay so much emphasis on being really precise, because we as default users, we really care about simplicity of a system. And also we have usually very broadly dispersed distributions, occasionally at least if the sample has become unstable or so, the distribution is usually pretty big. And if we want to quantify that, we definitely need a way to express this. So there seems to be a difficult question involved, and maybe you could explain a little further your thoughts on this.
Well, some of the talks this morning talk about the relationship between size and function. So the FDA, for instance, was being very clear about that strong relationship. So when you want to have your particle set validated, they want clear data. So if you are going to measure it, and you're measuring with a wavy line, and I mean that exactly because that's what a lot of it is, it's not necessarily the measurement of the particle, it's the interaction of the particle with that particular machine. And you could run that same particle set through a different machine and you get a different wavy line. So it doesn't really help. So what we're saying is if you calibrate it properly, you actually measure the real thing. So 120 nanometers equals 120 nanometers plus or minus your error range, which in our case is about 1 nanometer. So that means that you can do a measurement in your lab, you could send the particles to the FDA and they could do a measurement in their lab, you could send it to us and we would do a measurement in our lab, and they would all give you the same number. And then you can compare it and standardize it. And when you're comparing your data set with, say, you are doing a generic copy of the Johnson & Johnson Calyx product, for instance, then provided you're measuring them both properly, you can do an accurate comparison. Otherwise, you're just comparing a lot of wavy lines. So that's what the accuracy and precision is about. So, and also if you're doing development, you're introducing a relatively small change. Did you go to that talk this morning about the difference between research and development? And the mega euros on development. So development is a tweaking small change. You need to be able to measure what that small change is and measure what the effect of that small change is. And if the measurement error is bigger than the change that you're introducing, then you can't get anywhere. You just spin around and around, which I think is the problem of why there's 450,000 publications, 80% of which are not reproducible. So the field actually has failed. I mean, sorry, 80% failure is failure. 80% success, you get away with it. So it's junk data, far too much of it. So that's why we're saying do it properly, do it once, and then you are secure in the knowledge. That's the foundation of your work, if you like. You've got a strong foundation of a correct measurement. The accuracy isn't what matters so much. If it's plus or minus 1 or plus or minus 5 or plus or minus 10, I don't think that's the issue. It's the issue of what really matters and making sure you get what matters.
Thank you very much. Just one comment to that. I mean, the field has failed. We fail forward. We are a young scientific movement, I would say, and failing in science is always a good thing because you know you made something wrong and probably you can adjust to make it right.
Well, I was at a dinner the other night with somebody who's a very long-standing person. He made the point that the antibody market for drugs is 100 billion and the nanomedicine market is about 1 billion. And they've both been running at a similar rate. So I'm not an expert on that, but I was quite shocked actually at the numbers. So that's a big difference. So actually in the context of the drug world, the nanomedicine market is absolutely tiny. Considering the amount of effort that's gone into it, it's quite a lot of effort.
Definitely, you got a point there.
Yeah.
Okay, so Clemens, I wanted to know from you where you see nanoparticle tracking analysis going in the next years, and if users can expect the technology to become more easily applicable to everyday life in a lab, if the things will become more affordable sooner or later. What do you think?
Well, the future... Can you hear me now? Good. So basically, the future is, as you said, make it simple. However, as a manufacturer, we always see two sides. There are customers wanting to know everything. If you want to know everything, you have to put in a lot of work. So to make it simple and get everything is kind of a catch-22 situation. However, we also have customers in industry, and they require, of course, regulatory issues. And we have made a step forward in that already. We have so-called SOPs. Basically, all of the instrument parameters are stored in a log file, and you can recall this later on. So no matter who has been using the instrument before you, the instrument comes back in the exact same settings. So there's no confusion about what to take anymore from all those parameters you can set. This goes in the direction of the discussion, oh, NTA is not reliable or it gives interesting data. Mostly it has to be done with the setting of the instrument. And so we provide you with ways how to set the instrument and how to set it in a way that is reproducible for such as SOPs, meaning standard operational procedures. So this is already implemented in the current software. Of course, limit of detection is an issue. Expanding the working range is an issue. This has been proven that NTA works in the range between 10 nanometers and 1 micrometers. And this is the working range for the instrument. Again, it's also interesting to see kinetics. So, and there you need a little bit of speed depending on the time frame. So monitoring actually kinetics, meaning interaction of nanoparticles with each other, depends on the time frame. And so we are also took a step forward in order to do the scatter plots, and we can do this rather quick in terms of seconds. And therefore you can actually get information about reaction kinetics. Again, you need time, you make it quick and fast, and we can do this within seconds.
Sounds really great. Thank you very much. Okay, so my last question, and then I will definitely let the audience shoot again. Anna, I believe there is a trend that multiple techniques become coupled together, giving like a 2D analysis using tracking analysis and together with flow meters. I wonder if you could increase this cascade even more and add more techniques to give more answers simultaneously in one sample. So maybe you could quickly comment on the combination of anti-A and flow cytometry, and maybe you can share with us what you think will be coming next there.
I'm probably not the right person to speak about flow cytometry, but I can tell you that there is a lot of orthogonal techniques that are currently used with NTA. There is things like DLS. We do routinely use DLS for very nice, reliable assessment of the size distribution, number, volume distribution, and so on. And then we use NTA to get this good resolution for the results, to get the size distribution for particular populations within one sample. So we do know that DLS, for example, is very much limited in terms of resolution, although we can get a decent resolution for samples. However, using DLS and NTA, this is something that we do see now in the field as a very nice trend. In terms of other techniques, obviously there is flow cytometry is one of those, although we do have some feedbacks from the field and from people that we speak to. I mean, obviously there are advantages and disadvantages to both techniques, and obviously in terms of the size that we can access and so on. So obviously these are all the factors that we do have to take into consideration. The most important thing is, when we talk about orthogonal techniques, obviously, is to make sure that we get complementary information, not only the same information, just, if we get a size distribution from NTA, and obviously we do get size distribution from other techniques like DLS, we do need to make sure that we can compare this data and we can explain the data, by means of, complementary techniques, let's say. If we do want to analyze one sample, we do know that there is no one analytical technique that gives you answer to all questions. We do have to use multiple techniques in order to be able to see the whole picture. And this is I do understand that this is basically stating the obvious, but this is where it's all going. We do see trends where NTA is used in combination with all sorts of different tools, and we do see very, very nice story out of that kind of usage, let's say, of analytical techniques. So we do want to see a lot more of this.
Thank you very much. So if in the meantime anybody wants to share a question, please go ahead. And otherwise, I think we all can use some coffee. You do have one.
Just a question, maybe to make funny questions, more than scientific questions. I was surprised from the presentation of Eison. Some just numbers. So you presented 500,000 publications. So I was a bit surprised, and I just Googled on Google Scholar, and I just found much less. I don't say the number, but you can look, and Google knows a lot of things about everybody. So how do you calculate the 500,000?
That number came from a talk yesterday. I didn't know what the number was. Somebody else gave that
so
number.
So you didn't check?
No, it was a famous guy.
Okay,
I
nice.
just took his word for it.
Okay.
He put up a chart. It was Omid Farrokhzad.
So I need to ask him the question.
So what is the real number? It's fine. I mean,
it was 15 on Google Scholar, 15,000.
Well, he said 460 or
so
480,000.
I don't know about accuracy, but this is accuracy. Well,
it probably matters what search string you use. Nano and some asterisk will probably give a lot, in my experience. Okay, but I think we're running out of time. I'm sorry, I will have to stop the session here. I want to thank our presenters for sharing their insights and scientific knowledge. It was a really interesting session. And I look forward into shedding light together with analytics and consumers of manufacturers to forward nanomedicine into an area where patients as well as the public can benefit from technology as it should be. Thank you very much. Have a great afternoon.